This Sunday, I took a bike ride. During a time of pandemic, it's best to stay indoors, as our family has been doing. But if you do need to go out for some fresh air and exercise, a solo bicycle ride is not a bad way to do it, provided you stay away from other people. It's very interesting to see Amsterdam during a pandemic. It's a bit creepy to see the typical touristy areas with hardly anyone there. Amsterdam Centraal was like a ghost town. I've never seen it so empty. And it was bizarre to hear people in the city center actually speaking Dutch. But while the tourists have been forced to go home, keeping the city center nearly empty, there are still too many people out socializing. For example, organizing a game of basketball with your friends during a pandemic is just stupid and irresponsible. The Netherlands just went into a more strict lockdown on Monday, but the country that has handled this outbreak the best is another country I actually used to live in, Taiwan. My parents were living in Hong Kong during the time of the original SARS outbreak, and I was living in Toronto. Both were affected cities, so I was following it very closely at the time. Taiwan was particularly hard hit, and after the outbreak, they vowed to never let it happen again. As a result, Taiwan's approach to this latest coronavirus crisis has been impressive. As soon as there was information about a respiratory disease in China, the Taiwanese response was put in place. They started testing early and often for COVID-19, and they put in place very strict quarantine measures with hefty fines for violations. Taiwan also integrated their national health insurance database with their immigration and customs database to track infection cases, but that's not something that would be possible in the EU due to privacy legislation. Temperature checks and mandatory quarantines were put in place for travelers from several countries. By January 22nd, the government had distributed masks to retailers and set a maximum price of 300 Taiwan dollars, less than 10 euros, for a box of 50. That price dropped over the next few weeks as almost 10 million masks per day were produced in the country. Very quickly, everyone in the country had access to inexpensive surgical masks. Surgical masks will not prevent you from getting COVID-19, but surgical masks will make it more difficult for you to spread the virus to others. And by February, everyone was wearing a mask when they went outside in Taiwan. We lived in Taiwan in 2010 and 2011. There were no epidemics during this time, but the mask culture that is common in many Asian countries was very obvious. I can look back to my videos of that time, and whenever there's a crowd of people, it's easy to find someone with a mask. This man, this woman, this man, these people. Oh wait, no, they're carrying their dogs everywhere they go, something that's also common in Taiwan. The guy with the mask is over here. Westerners often misunderstand these masks. They usually assume the person wearing the mask is trying to protect themselves, but instead, the person wearing the mask is sick, and they're wearing it to avoid spreading that sickness to others. I wish this were more common. Protecting other people when you're sick should be a common courtesy in Western countries as well. On my social distancing ride, I came across only a few people wearing masks. But of course, masks are hard to come by in the Netherlands because nobody prepared for it, and what little stock is available is, quite reasonably, going to hospitals. It would be nice if a Western mask culture came out of this pandemic, but I doubt it. Western countries aren't collectivist enough to make that happen. All of these interventions in Taiwan worked. There have been only a total of 195 cases of COVID-19 found in Taiwan. Here's a page showing all of them. Blue is cases found in travelers coming into Taiwan, while orange is cases that spread inside the country. SARS-CoV-2 did not get a chance to spread in Taiwan. After about a 3-week shutdown over the Lunar New Year, Taiwan is now no longer under lockdown. However, this is only possible because of the interventions that are still in place. Almost everyone outside is wearing a mask. Elevators, ATMs, and public transit is being cleaned constantly. And temperature checks are absolutely everywhere. A friend of mine said he's getting his fever checked about a dozen times a day. At the parking garage, at the office, at the gym, at restaurants. Anyone found with a fever, or coming in from a flight from an affected country, needs to go into immediate 14-day quarantine, tracked by GPS. One man who skipped quarantine to go clubbing the other day was just fined 1 million Taiwan dollars, about 30,000 euros. Taiwan is not messing around. The Netherlands wasn't affected by the original SARS outbreak, and some people here, like the basketball players, aren't taking it very seriously. It's very important that even young people stay away from others to avoid spreading it to vulnerable people. But a lot of people seem to be acting like it can't affect younger people, and it can. I was traveling to Asia regularly in 2009, around the time of the H1N1 swine flu epidemic. I managed to contract H1N1, and it was the worst 8 days of my life. This is the only picture I have from that week. It was horrible. If you get COVID-19, it's very possible that it'll be the worst 3 weeks of your life. 80% of people get mild to moderate symptoms, but those moderate symptoms include pneumonia. This is not the common cold. It will suck to get this. I'm glad the Dutch government implemented a more strict lockdown with fines and enforcement because it's absolutely necessary for people to take this seriously. So please, stay home. And when you do have to go out, keep at least 1.5 meters distance from other people. I just hope that after all of this is over, it leads to a better level of understanding and preparation so that the next time this happens, the Netherlands will be more ready, like Taiwan.